Hi and welcome Camden BRI members and thanks for attending this webinar. My name is Martin D'Agostino. I'm the Virology Section Manager here, and today I'm going to be giving a review of the UK situation with regard to SARS-CoV-2 and foodborne viruses. So today I'm going to be covering the difference between norovirus, which is a normal enteric virus which is normally transmitted by foods, and versus coronavirus. So some information just highlighting the main differences between these types of viruses. We're going to have a quick review of some frequently asked questions regarding SARS-CoV-2 that I've had here. We're also going to be having a look at some guidance which is now available in the UK. Also some Camden BRI service related to viruses and some other virus news in brief. So I'd just like to start off by introducing the differences between SARS-CoV-2 and other enteric viruses. Norovirus and hepatitis A viruses are referred to as non-enveloped viruses, and these viruses can be quite resistant to various treatments and harsh environmental stresses. The strains of norovirus and hepatitis virus of main concern originate in humans and are not known to cause illness in animals. And they are the main viruses of concern in terms of foodborne viral infections, although others can also cause infection in humans, such as hepatitis E virus, which affects the pork supply chain. Their main transmission route is still via human-to-human and surface-to-human contact, and is via the fecal-oral route. However, they can be very easily transported on the surface of foods if they become contaminated, either after handling by contaminated hands or gloves or by contaminated irrigation water. Outbreaks have also been associated with vomiting incidents on cruise ships, planes, and restaurants. Looking at SARS-CoV-2, this is referred to as an enveloped virus, and it's part of the Coronaviridae family of viruses. And this pertains to the structure of the virus having a lipid protein coat, which is usually not very stable and can readily be destroyed by substances which disrupt this coat. For example, greater than 60% alcohol and soap and detergent. Now, many coronaviruses can be traced to wild birds and include strains which cause the common human cold. These viruses can cross between the species barrier and are known as zoonotic, and this term also applies to hepatitis E virus, which can be transmitted to humans via pigs and other types of game, including some deer species. But as we are all now well aware, inhalation of droplets from a sneeze or cough from an infected person with SARS-CoV-2 is the main transmission route of this virus. The main control measure regarding the risk from handling food products, which will reduce the risk from both types of virus, is really good and proper hand hygiene, hand washing it with soap and water. If foods can be cooked thoroughly, this is the next best control measure, certainly for enteric viruses, as well as for coronavirus. And as regards alcohol gel, that's well known to destroy coronaviruses, but is much less effective against enteric viruses such as norovirus, and that's where some confusion can lie. So just to summarize, the main risk of illness associated with the consumption of foods remains, in the microbiological area at least, the ingestion of bacterial and viral pathogens. However, it is likely that the increased awareness of foodborne viruses in general, such as norovirus and hepatitis A virus, has had many concluding that SARS-CoV-2 might potentially be a foodborne hazard as well. Hence my increased involvement in trying to understand the risks to the food industry, which has been ever changing over the past few months. So we're now going to consider just a small selection of the questions that I've been asked by members over the past few months in relation to this virus, and some answers that have been provided, but bearing in mind that there is still a lot unknown about the precise characteristics of SARS-CoV-2. So I'll start with the questions that were raised early on in the outbreak, which were mainly focused around fears of raw ingredients and packaging from China and Italy, which were the main high-risk areas in the beginning. Concerns were raised about infected individuals coughing or sneezing on products, and the possibility that this could be a way that the virus could be transmitted to recipients and consumers. And questions over whether the cooking process were also raised, including what if flour became contaminated. Now, in the majority of cases, the answer was fairly straightforward, that the risk was minimal based on research performed on other coronaviruses, such as the original SARS and MERS outbreaks. The viruses will not remain infectious for long periods on surfaces, and they can be readily inactivated by normal cooking temperatures. Questions were also received by members from customers directly as well, again regarding the risk posed by a product's ingredients, and in general, many questions have demonstrated that there is still a general lack of understanding regarding the transmission of viruses in foods, which hopefully, after this experience, will have improved significantly. However, it has highlighted the need for continual training in this area. There were also concerns about goods drivers from high-risk areas to lower-risk areas, and what should be done to minimize the risk of those drivers infecting the recipients of their goods. And this was before the term social distancing was being widely used. So there was a definite shift towards measures needing to be put in place to protect employees and procedures for visitors from high-risk countries to lower-risk countries at the time. And the question of whether face masks and other additional PPE was raised several times, and in general it was decided that the usual PPE would be enough. However, now there has been a shift with the guidance on face masks, including how to wear them properly, what materials to use, etc. And since there was a huge concern over the availability of face masks for key clinical staff, again, this still remains a question which is raised quite a lot. Guidance, however, can be found on regulatory authorities' websites with regards to the wearing of face masks. Which cleaning methods should be used was another common question, since the recommendation on the gov.uk website and Public Health England was to clean contaminated areas with a 1,000 parts per million bleach and detergent solution. However, in many places this is not acceptable due to residues on food contact surfaces and for many other surfaces, including electronic equipment and materials. The guidance was given to have a means of decontaminating an area where there was suspected infective material from an infected person. However, if there's no suspected contamination, normal cleaning regimes should be continued, perhaps just with a more frequency where local updated risk assessments have indicated the need for this. So, more recently, there have been inquiries regarding how to minimize the risks for a returning workforce. Now, in general, this would depend on the individual workplace and the updating of risk assessments to take into account additional measures required to counteract the risks from COVID-19. So this may include both physical and procedural controls. So things like partitioning off of desks or making people sit back to each other rather than facing each other. We'll be putting one-way systems into place in corridors, and it may be closing off certain entrances or exits depending on the need and the way that the workflow is. But key is also good communication of any changes to the workforce and the workflow to ensure that no misinformation is being circulated. And extra effort should be given to train those, if required, who need to know about the extra information or extra changes that have been put into place in their workplace. For example, in terms of physical distancing procedures and perhaps increased hand washing practices. Also important is to ensure that signage is nice and clear throughout the workplace to ensure that people are reminded of the additional measures put in place at every opportunity. Now recently, the United Kingdom Food Standards Agency has published new guidance for the food industry titled Reopening and Adapting Your Food Business During COVID-19. This link can be found at the bottom of the slide. One of the main themes of this guidance is really to ensure that risk assessments are updated to address the risks from COVID-19 and to ensure that these changes are documented in relation to existing HACCP procedures. But really, the guidelines are there for employers and employees and the self-employed to really understand how to work safely during the ongoing pandemic if they have to go into the workplace. Focuses have been on hygiene processes and requirements which must be followed while they are on site. And this really provides a practical framework in conjunction with wider government advice. So there's lots of information on other regulatory websites with regards to working whilst COVID-19 is still an issue. As I said, risk assessments to address the risks of COVID-19 to your business should be addressed preferably before everyone goes back into the workplace. And how do these additional measures impact on existing food safety management systems? If they do, these should be documented clearly, especially if they are impacting on a HACCP requirements, and informing of local food authority is also a requirement as well if these change. So as you can see, the link, as I mentioned, is there at the bottom of that slide. So Annette Sansom in the microbiology department at Camden BRI has developed a new test for determining the efficacy of disinfectants and sanitizers using a surrogate virus which is very similar in size and structure to SARS-CoV-2. It's an enveloped bacteriophage. Many current methodologies concentrate on the use of viruses which are non-enveloped, so this is really relevant to those wishing to test the efficacy of perhaps hand sanitizers that they're putting on the market or disinfectants in the context of this current outbreak. For more information on this service, please contact either support@camdenbri.co.uk or Annette Sansom at camdenbri.co.uk for more information. And if you'd like a quote for that work, please feel free to contact them. Another area where we have had a lot of interest is in environmental monitoring for SARS-CoV-2. Now at the moment, nearly all efforts have been towards prioritizing patient samples, which of course is still the #1 priority. However, there is also a need to address the issue of those businesses who will be reopening now or in the near future. So that may include virtually anywhere that there will be a larger number of people returning to work, whether that be schools, restaurants, other supermarkets, other places, other food factories, or other factories in general, where large numbers of people may be returning to work. There may be concerns regarding the efficiency of the cleaning procedures in place, and efforts might need to be taken to reassure the workforce that all is being done to minimize the risk to them. And this service could supplement existing environmental monitoring and can focus on frequently touched surfaces in zones around the workplace. So for more information on this service, which will soon be available, please either contact support or myself directly. So just in the last 2 slides, I just wanted to highlight the recent report, first of all, released by the FSA, which was somewhat overshadowed by COVID-19, but which is still of great relevance to the food industry. New estimates of numbers of foodborne illnesses were reported back in February, which revealed that the numbers of illness in the UK from foodborne pathogens more than doubled from 1 million back in 2009 to around about 2.4 million now. Norovirus was revealed to cause the biggest number of foodborne related illnesses, estimating at around about 383,000 cases per year. The risks were ranked in terms of percentage of cases related to type of risk, with most risk being eating out at 37% of cases. Lettuce at retail at 30% of the total number of foodborne cases. Takeaways at 26% of cases, followed by raspberries at retail at 4% of cases, and oysters at 3% of cases. Consumption levels were taken into consideration when estimating these figures. So, as I say, this information was published in February 2020, just around about when everything started flaring up with COVID-19. So a lot of people may have missed this, but if you want more information on that, please either contact myself, as I was involved in the study which produced this information, or have a look at the FSA website, which you will find this on as well. So finally, what can Camden BRI help with in regards to this issue around foodborne viruses? Well, we are still the only laboratory in the UK who analyse fresh and frozen produce for norovirus and hepatitis A virus, and we are UKAS accredited for this analysis. We can also analyse pork products as well for the presence of hepatitis E virus. Currently, there is no standard method available for this. For more information on any of these services, please feel free to contact us directly or through the support email. Thanks very much for listening.